if we think more systematically about the adaptive strategies that we should be considering, there are many of them, and this just lists for us the top 4 that apply to multiple sectors in terms of public understanding, early alert systems for different threats to health, meteorology, facilities, becoming attuned to better early warnings of impending heat waves, for example, better sense of community support and caring for vulnerable individuals, isolated persons, better urban and housing design, and then in the bottom half, things that are more specific to the health system at large, including disaster preparedness, enhanced infectious disease control programs, improvements in data collection and surveillance, and of course appropriate workforce training and research capacity. Again, something that hopefully the Public Health Foundation of India and its associated regional institutes of public health will be able to contribute to. Just one example to help us understand that these things are achievable. Some very interesting work done in Botswana a couple of years ago, published in Nature 2 years ago. A group at Columbia University had said, well, let's see how the outbreaks of malaria over the last couple of decades relate to the observed patterns of rainfall during summer. And at the top you see that the high malaria incidence rates mapped very well on the high rainfall, the blue areas, and at the bottom, when there was low malaria, those were low rainfall years. They then were able to go back and use the historical meteorological records and say, well, actually, could we get that information in advance? Could we use the meteorological records from 3 months ahead of summer to predict what the likely subsequent malaria incidence would be? So this time they repeated the analysis using not the observations made in summer, but the weather predictions made 3 months earlier, the forecast predictions. And again, a pretty good map there, a match between the prediction and the outcome. So they've suggested that this actually provides that society with an extra 3 months of advance warning to prepare for an above average outbreak of malaria. So this would be an example of an adaptive strategy to help that society cope rather better. So, in coming to conclusion then, I want to make 3 points here about why we should be interested in improving, expanding our research capacity. I say here for climate change, but bear in mind that, as I said, it's part of the larger syndrome. There are many other great environmental changes that are now starting to press on whole regions and the world at large, and this applies across all of those. And the first thing, of course, is to recognise the health risks, because this will help societies take action to reduce or to avert those climate and environmental changes, mitigation. Secondly, those mitigation activities themselves, as we've just discussed briefly, ought to provide a number of health benefits if we choose wisely and move to more sustainable practices, and may thus also help to revitalise, expand our health promotion. And finally, there are health risks already, and more of them in the pipeline, unavoidable, so we've got to take actions to reduce those risks by developing and evaluating adaptive strategies. So there's really a very wide spectrum of important, urgent, challenging, very interesting research tasks. It's going to require new concepts, new methods, training people with new skills, developing new collaborations. There's a lot that's positive and exciting and challenging about all of this, and if we get it right, we in the health sector can make a great contribution to helping our societies get the full measure of these risks to well-being and health, and take appropriate action on behalf of not just this generation, but future generations. So a reminder, here's our habitat, just one limited planet. The atmosphere around it is so tiny and thin we can't see it, like the skin of an apple, and including and in light of this challenge that's before all of us, my best wishes to the Public Health Foundation of India. This is an important, bold and very timely initiative.